Today, we will be talking about Genesis Medical Group with Dr. Ellen, our founder. We are the largest privately owned medical group in Houston. Is that correct?
Yes, that's correct.
Okay, so tell us about how you founded Genesis, what your vision was for it, who we are, what we consist of.
The idea of Genesis Medical Group is provide the best possible healthcare with patients close to their home. The Genesis is one-stop shop. The problem with medicine right now is it's very disjointed. Somebody does something in the hospital here, and then the doctor doesn't know what's happened to the patient. Then the patient is sent to the specialist. Again, no interaction between the specialist and the primary care. A lot of problems created that way.
Absolutely no continuity of care.
And that is a huge problem. There are drugs that are prescribed which could be detrimental because people don't know the details of history. In details, that's what makes medicine. So, about 10 years ago, I had an idea and a dream to create a group where the doctors come together, where we can provide the best possible care for the patients, utilizing modern technology. We use the best machines possible. But more importantly, every person that patients interact with has a heart. They have to care about the patients. Otherwise, I don't want it to be part of our family. The patient has to be part of our family. They're not a number, they're alive.
You hit on something that I think is really important that separates us from larger, like hospital based systems. We're a family. We're large, we've grown quickly, we're comprehensive, we have lots of different specialties, 120 providers, 800 employees, but we're still very close knit. Really important, something that I think is needed in healthcare. So let's talk about a real life example of how continuity of care within the medical group can make a difference in patient care. For example, I have a patient come in and chief complaint might be severe fatigue, really tired, symptomatic as far as, anemia symptoms, maybe having palpitations already. What makes the difference is that we have hematology right next door and oncology. And so I can refer the patient to a provider I personally know. I can walk the patient over and get in. They don't have to wait to go to a different location at a hospital, maybe wait several weeks for access. And so I think that's really one of the things that separates us as a medical group.
So it's actually a very important point. Not only we are on same insurance, meaning your oncologist, your rheumatologist, your cardiologist are taking same insurance as primary. As you said, the patient can walk in from your office to my office, or you can just ask me questions because time to action is very important. If the patient fatigue and God forbid it some kind of malignancy, we got to find out now. We cannot wait months to see what happens. The combination of our powers is tremendous to take care of patients. And if we need to do anything else, for example, rheumatology, there is a new technique where rheumatology, especially hands or knees, you can do a low dose radiation. We're one of the few rheumatology offices that have access to radiation centers. Instead of using drugs, maybe we can do a low dose radiation. Same thing with oncology or hematology. Yes, patient might have anemia, maybe they have something else. We could be determining what could be biopsy, how to approach it, and more importantly, here for the patients, the combination of my power and your power. That's what makes Genesis very powerful.
We're like a big net.
We big net and we are powerful. Brains are combined.
Time is of the essence. And so, what we offer as far as continuity of care, when you're going from my office to Dr. Ellen's office, you're not going to a brand new place to see a provider that's never seen you, doesn't know anything about you. Dr. Ellen's going to have access to all of your history, all the notes I've written on you, all the medications you've taken, the dose. There's no guesswork. At Genesis, we pride ourselves in not only being a family, but being able to take care of the whole family. That's why we have every kind of specialty, including pediatrics.
Yes, pediatrics is very important, but we also want to take care of moms. We spoke about fatigue. Sometimes fatigue could be something beyond something physical. Psychiatric services provided at Genesis. We have something even more than normal psychiatric office has. We have TMS. We have treatment which does not require drugs, and it's very powerful treatment. Not only we're looking to provide services for the patients, family, their kids, we're also looking to make sure they're done at most efficient, effective.
not just treat medical conditions, but make sure that you are as well and as healthy as you can be. So even if it's not, needing a medication, we even have functional approach to things. If you need a nutraceutical, you need vitamin infusion, any way that we can help you feel your best. Tell us a little bit about what your vision for continuing to grow Genesis is.
We are successful, but we are successful because we care. We are largely privately owned group because I'm not bound to Wall Streets, because we're not bound to some money guys. All we care is about to make sure we take care of our patients. And that's the dream, and that's our hope, and that's what we do. And we're growing. We're opening office in Nacogdoches fairly soon. We are in San Antonio. There are about 25 plus providers in San Antonio. We're possibly going to Rio Grande Valley and in Houston. There are more than 20 offices in Houston. There are more than 40 offices right now throughout the Texas area. We're trying to be next to the patient. We're trying to be 5 miles away from the patient home. What we're trying to do is position them every 10 miles. So if there is an issue, we're right there. 10 minutes drive, but we are close by.
And then we have our urgent care.
Yes, we have extended hours and urgent cares because if patients get sick, I want them to be seen. We want to take care of the patients. We don't want to send them to ER where sometimes people don't know what's going on with the patient, but more importantly, they can get sick from the nosocomial infections. We want to make sure that we keep patients away from the hospital. If it's something that we can handle, we want to make sure we handle it in a very effective manner. That's what we're here for. We want to make sure that knowledge between doctors is passed and we treat them as a family. And
That's what knowing our patients is about, taking care of them in house because we know them.